Okay, why don't we get started tonight? Welcome to this evening's event on From Crisis to Complacency. We're going to be looking at public opinion relating to COVID-19 in Canada. I'll welcome in a few minutes our guest speaker, Dr. Cliff van der Linden from the Faculty of Social Sciences, McMaster. My name is Jeremiah Hurley, and I'm the Dean of the Faculty of Social Sciences at McMaster. And before we begin, I would like to acknowledge that I'm speaking to you from the lands, traditional territories of the Haudenosaunee and the Anishinaabe Nations, protected by the Dishwit-Tuspun Wampum Agreement. As I said, this evening we're going to be speaking about public opinion regarding the COVID-19 pandemic. And I will get right to it and introduce our speaker, Dr. Cliff van der Linden, who is an assistant professor in the Department of Political Science at McMaster University. He's also the director of the Digital Society Lab in the Faculty of Social Sciences. And he is the CEO of Vox Pop Labs, a social enterprise that developed Vote Compass, a voter engagement and education app used now by more than tens of millions of citizens across multiple countries internationally during their electoral processes. His research focuses on the implications of technology, both for the practice and the study of politics, and he has advised numerous governments on digital technology and public opinion research. And tonight, Cliff is going to be sharing the results of an ongoing project he's leading called COVID Monitor, which is tracking Canadian views about COVID-19, government's response to the pandemic, and citizens' behaviors during the pandemic. And so with that, I'm going to just turn it over to Cliff to get started on tonight's Socrates event. Thank you, Cliff.
Thanks very much, Jerry, and thanks everyone for joining. I'm pleased that you could be here this evening with us, even albeit virtually. Before I begin, I would just like to thank and acknowledge some of the sponsors of this evening's talk. So the McMaster University Faculty of Social Sciences, of which Jerry is Dean, of course, who helped sponsor this research with the internal COVID-19 Catalyst Grant, the Socrates Project for hosting this event, and the Digital Society Lab, a new initiative at McMaster University, which I hope everyone will hear a lot more about in the days, weeks, and months ahead. So let me get right to it, as I have a fair bit to share with you this evening. The objective of tonight's discussion is to try to provide some answers to the question, how has public opinion in Canada changed over the course of the pandemic? And the way we do this is with a survey instrument called the COVID-19 Monitor, which Jerry mentioned briefly. So the COVID-19 Monitor is a rolling weekly public opinion survey, which was first launched in mid-March, shortly after the WHO declared COVID-19 a global pandemic. And it draws from Vox Pop Labs' online respondent panel, which contains about 750,000 Canadians who have volunteered to participate in various studies that we run on politics and public affairs. We've been drawing weekly samples from that panel. They're pre-stratified to roughly represent the population of Canada. And then the data are also weighted to ensure that we precisely represent the population of Canada when we're treating the data. These samples run between a little under 3,000 to just under 2,000 respondents per week. So it is quite a large study. It is the largest study of its kind currently running in Canada monitoring COVID-19. You imagine the sample size and the fact that it's run every week at the least. It becomes quite a large study and a very valuable source of insights for all of us into how Canadians have been reacting to COVID-19. You can see some high-level findings for yourself at covid19monitor.org, but tonight I'm going to go into some details that you won't find on that site that parse the data a little more thoroughly in an effort to better understand some of the nuances of Canadians' responses to the pandemic. So just very briefly, I will be presenting a series of time series analysis, largely, some other analysis as well. But the beautiful thing about this particular survey instrument is because it runs every week and because it's drawn from the same online respondent panel every week, different respondents, but the same panel, um, uh, we not only have extremely large samples, which allow us to look at more granular details about the behavior of Canadians, but because we're running it at least once a week, we have a very robust time series, so we can look at a lot of changes over time in ways that you can't with conventional polling instruments. And I should say that the monitor not only runs in Canada, it also runs in the UK and Australia. Our partner in Australia is the Australian Broadcasting Corporation, and we are launching it as well in the US, in New Zealand, in Germany, in Brazil, and in France. So it will become a very rich source for comparative analysis of international attitudes towards COVID-19. And I'll say as well that the data to date have been used to provide some information to governments around the world and also to media organizations as part of their analysis. So that being said, let's jump into some of the findings. I've tried to categorize the findings in thematic ways to get at some of the areas of interest that have come out of the monitor. So I think the first question we can ask ourselves is around concern. How is concern towards COVID-19 manifest over the course of the pandemic? And if we want to look at concern about personally contracting COVID-19, you'll see each wave is represented on this on this graph, and you have the confidence intervals for each wave. So it's 95% confidence interval. So for those of you who aren't that familiar with the representation of confidence intervals, statistics are about probabilities. These estimates that we represented each wave are just that, they're estimates, and we suggest that we have 95% confidence that they fall within the range represented at each of these points. And the important thing there is that if confidence intervals intersect each other, that means that we're not sure that any two estimates are statistically significant from one another. So the first time series that we look at is the degree to which Canadians are worried about personally contracting COVID-19. How worried are Canadians in general? And you'll see that concern has declined gradually over the course of the pandemic. Only around 16%, 17% of Canadians in our last wave, which was fielded last week, say that they are particularly concerned about contracting COVID-19. Concern is higher, though, when you look at friends or family members. So here you can see that people's concerns about a friend or family member contracting COVID-19 is quite a bit higher. It's significantly higher than the personal threat of COVID-19. However, by far the largest concern, and across the course of the pandemic, has been about the economy. So more people indicate that they're concerned about the economy than any other question that we asked related to the possible transmission or contraction of COVID-19. So it really is the economy that is the main point of concern for Canadians. How does the economy translate into specific concern for Canadians? Well, 18% of Canadians are concerned about their ability to pay their bills. And the only real decline we've seen over the course of the campaign has been this green line, which is about the ability of the public health care system to provide adequate care. So only about 23% of Canadians are now concerned about the capacity of the public health care system. But at the outset of the campaign, you can see that was much higher. Next to the economy, if you look under wave one, and I've lost my ability to annotate as I was doing earlier, so I apologize. Let me just quickly see if I can find a way to do that readily. So no, I can't. If you, sorry, I'm just going to try once more out of persistence, but no. If you look at the green line and you look at the beginning, you can see that almost half of Canadians in wave one, at the beginning of the green line, were concerned about the ability of the public healthcare system to provide adequate care. That's more than halved by the end of the campaign. If you look under wave 15 at the end of the graph, it's 23.2%. So you've seen a real decline in concern about the capacity of the public healthcare system to take care of us should we get ill during the pandemic. Now, we've talked about concern. So how does concern translate into compliance? What can we say about the degree to which Canadians are complying with the guidelines that public health officials have set out for Canadians during the COVID-19 pandemic? Well, if we look at hygiene compliance, so compliance with some of the hygienic guidelines that the Public Health Agency of Canada put out at the beginning of the campaign, and you ask, have people adapted their routine to do things like wash their hands more often with soap and water, which is what this first line represents? You can see that Canadians are highly compliant with some of these hygienic measures. They've also indicated, almost 3/4 of Canadians have indicated that they've been more active in terms of cleaning and disinfecting surfaces that they touch with some frequency, and that's remained relatively consistent across the course of the pandemic. You can see that more than 80% of Canadians are using alcohol-based hand sanitizers. Now that's jumped since the outset of the pandemic, but my suspicion is that's largely a function of the availability of sanitizers. Of course, they were less available at the beginning of the pandemic, so people weren't as accessible to people. But people are using them more now than they were at the beginning of the lockdown and restrictive measures. That people are doing things like coughing or sneezing into a tissue or the bend of their arm instead of their hands, as we've been advised by the Public Health Agency of Canada to do. And finally, in this last line, they're avoiding things like touching their eyes, nose, or mouth with unwashed hands. So you can see all of these lines indicate that a majority of Canadians are taking stock of the guidance that public health officials have given them, and they're acting in accordance with that guidance. So Canadians are relatively compliant when it comes to hygiene measures. Now, when we start to talk about distancing and the advice around social and physical distancing, we do see some differences. Although most Canadians, in fact, a vast majority of Canadians, have said that over the course of the pandemic, they have endeavored to keep a 2-meter distance from others wherever possible, which is what this line represents here. And you can see at the legend at the bottom of the screen, it's indicating what that line represents. So people are complying with the practice of physical distancing. However, we have some other measures where we've seen some significant decline since the outset of the pandemic. So for example, avoiding all non-essential in-person contact outside your household, that's fallen roughly 15 points since the outset of the pandemic. We've seen a decline in the number of people who say they're avoiding gatherings of more than 5 people. So it was at about 90% when we started measuring this, which was in the 4th week of our rolling study. And now only 65% of Canadians indicate that they are still avoiding gatherings of more than 5 people. Of course, some of this has to do with changing provincial guidelines around who you can gather with. So it's not actually indicating non-compliance. But certainly, if we're looking at a decline in these measures. Similarly, even avoiding gatherings of more than 10 people, which in most provinces is the limit, we're seeing that fewer and fewer people are adhering to that limit. Only 71.3% of Canadians say they're avoiding gatherings of more than 10 people. And that again is a decline from the outset of our measurement. And then finally, avoiding public transit, that's remained roughly consistent over the course of the pandemic so far. And then finally, where we've seen a real decline is in terms of not going into work or working from home. So people are, of course, returning to work. And again, this has some obvious this is obviously implicated by changing levels of restriction across various provinces. Now, when we ask questions about whether people have done any of whether people have been in each other's homes or gathered outside, what we do see is, again, more and more people visiting other people's homes. This graph shows over the course of the pandemic, you see that now up to about half of Canadians say they visited someone's home in the last week. Moreover, They say they've had someone over at their home who doesn't live with them in the last week. So Canadians are opening up their homes and they're going to other people's homes, and that certainly is rising. Again, this is not necessarily non-compliance. Of course, we recognize that in many provinces, it is now the case. But what we do see is that the engagement in engaging in this type of behavior isn't necessarily something that is consistent with the moment that legislation was passed. It's something that's happened sort of gradually, of course, across the course of the pandemic. And then finally, getting outside together with people who do not live with you. Again, this is something that that is not necessarily non-compliance, but we see that all of these three measures had roughly 10% of, or a little over 10% of the Canadian population in week 4 of this survey indicated that they were engaging in these activities, and now it's close to 50%, if not higher. So that tells you something about the level of compliance that we're seeing in the population with some of these measures, that preventive measures from public health agencies. Now, a really interesting finding, and one that deserves a fair bit of investigation or exploration, is the wearing of masks, the usage of masks. As many of you will know, or all of you, the public health guidance on masks has substantially reversed since earlier this year, when masks were actually actively discouraged by the WHO, by the US Surgeon General, by the Public Health Agency of Canada, and others. Now, of course, it's not only suggested but advised that masks be worn in public spaces, and there are even discussions about whether or not masks should be mandatory in public spaces. When we look at mask adoption in Canada, we see the single most substantial increase or change of behavior among Canadians in terms of compliance behaviors. So in late March, we saw hardly anyone indicating that they were wearing masks. And now more than 71% of the Canadian population self-reports as wearing masks when they go out in public. And they also note it as a change in their behavior. So it's not even people who may have worn masks previously or before the pandemic. So that is a very large increase in terms of mask usage. And clearly these, unfortunately, I don't have the dates of the waves in the x-axis because it would make it very difficult to read. But the dates in which these spikes happen in the graph, they are coordinated or correlated with new guidance from, for example, the Public Health Agency of Canada. So you see a jump from wave 3 to wave 4. And that jump takes place as the Public Health Agency of Canada made its first recommendations, moving away from actively discouraging masks to suggesting or that they may be worn at the discretion of Canadians. And then you see in wave 6, for example, or sorry, in wave 8, you see a move from wave 8 to 9, you see another jump, or a bit of a jump, and that jump is associated with when Prime Minister Justin Trudeau started wearing masks in public. And so you see this gradual increase that tends to be consistent with the changing guidance that we've been receiving from the Public Health Agency of Canada. And one way you can tie it to this changing guidance is to look at mask adoption in Quebec, which took a rather different course of action. So the gray line here is the rest of Canada, and the maroon line is Quebec. And if you look at those lines, you'll see that it took Quebecers quite a bit longer than people in the rest of Canada to start wearing masks. And if you look at what was going on in Quebec, the National Health Director and François Legault, the Premier of Quebec, were not that supportive of the initial PHAC, Public Health Agency of Canada, announcements around mask adoption. And so it's interesting that public behavior in Quebec very much lines up with the kind of advice that Quebecers were receiving from their provincial officials. Of course, there was a bit of an about face from the Premier and the National Health Director, which happened between wave 7 and 8, and then suddenly you see a closing gap between those two waves, which is indicative of people in Quebec complying with the new advice or the new guidance that provincial officials started to issue. And now you see Quebec catching up, if not surpassing, the rest of Canada in terms of mask adoption. Now, another really interesting finding about masks is how ideology has started to play a role in wearing masks. So we've seen this, of course, happen in the United States. Many of us have seen news out of the United States of people suggesting that wearing masks is an infringement on their civil liberties, on their individual rights, and that they shouldn't. And this comes largely from an ideologically right-leaning discourse. In Canada, at the outset of the pandemic, you didn't see this ideological divide. If you break down Canadians into those who identify as left-leaning, those who identify as centrists, and those who identify as right-leaning, and you look at waves 1, 2, and 3, and in the early days of the pandemic, you don't see any difference. They all sort of had the same adoption rate in terms of masks. But if you move all the way to the right side of the graph and you look at wave 15, then suddenly you get statistically significant differences between all three groups. So masks have become ideological in Canada as they have in the United States. And you can see this in terms of partisanship even. If you look at the declared vote intention of people who choose to wear masks, it's significantly lower among Conservative Party voters than it is among those who would vote for the Green Party, the Liberal Party, or the NDP. Now, I should say that the Bloc Québécois Bloc Québécois voters look the same to some extent as Canada's more progressive or left-leaning parties. But if you look at the time series of the Bloc Québécois, it sort of tracks Quebec discourse and the discourse from the Quebec leadership. So Bloc Québécois voters at the beginning were very reluctant to wear masks, very reticent, almost at the same levels as Conservative voters. But that grew, their support for masks grew over time as the discourse in Quebec, as the elite discourse in Quebec shifted. Now, we've talked about the wearing of masks. What about support for mandatory mask usage? So there have been discussions in Canada. There are about 50 countries around the world that mandate mask usage when in public. What do Canadians think about this? Well, we didn't ask this question in every wave of the COVID-19 monitor, so you'll see a dotted line during the waves where we didn't ask questions about mandatory mask usage, but we did ask it early on in wave 4, which would have taken place in April, and we asked it in wave 5, and then we asked it again in waves 12, 13, 14, and 15, and you can see a dramatic rise in support for mandatory mask usage. So even in April, support for mandatory mask usage was at 40%. Now, as of last week, it's at 65%. So you do see Canadians really rallying behind this idea of masks and looking for mandatory mask usage, at least the majority of Canadians. I want to turn to some of the effects of the pandemic. So we've talked about concern, we've talked about compliance. Now let's look at some of the effects that we found in the data from the COVID-19 monitor. And one of the often discussed implications of restrictive measures in the lockdown has, of course, been around mental health. And people are asking, what are the implications of the pandemic on people's mental health? Well, if we look at these numbers, and we've been asking about mental health since the outset of the campaign, and we've been asking people to characterize their mental health generally and presently. So how is your mental health in general, and how is your mental health at present? When we ask about, so we use the generally as a baseline. So the objective here is to get a sense of what people's mental health is sort of on average and perhaps before the pandemic. And if you look at the figures here, then you can see that there has been an increase in terms of evaluations of the present status of mental health as being poor. So more people say their mental health is poor or fair, and fewer people are saying their mental health is very good or excellent than do in general. So certainly we see evidence there that the pandemic and that the lockdown that's been in place have had implications for people's mental health. Where we really see an interesting difference or breakdown is when we look at mental health by age group. So when we look at the youngest Canadians, their representation or their view of the decline of their mental health is quite striking. So if you look at this graph, the maroon colored bars are 18 to 34-year-olds, 35 to 64-year-olds are the gray bars, and the teal bars are people 65 plus. So you'll see that in general, people who are 65 plus, interestingly, given that they're the demographic that is most at risk, or at least was perceived to be most at risk in terms of major complications from COVID-19, they still have the highest self-reported mental health ratings in terms of reporting their mental health as excellent or very good. Whereas you see among the youngest Canadians, you see the highest levels of self-reported poor and fair mental health. So the age, certainly the age or the generational divisions here are striking. Then if we want to look at, if we look at gender, there's been some other very interesting and concerning implications around gender. So there have been discussions around the effects of COVID-19 and the lockdown in terms of the distribution of household labor and responsibility, particularly for households that have children. When we look at the average number of hours per week spent doing unpaid housework, like meal preparation, yard work, or home maintenance, what we see is that in families where there are children ages 15 and under, we see that women have taken on more additional responsibilities to men, even though prior to the pandemic, they already report nearly double the number of hours spent doing this kind of work. The only thing I'll flag here is that these results are not statistically significant. Where we do find statistically significant results is when we talk about childcare. So the results when we look at the gender differences around childcare during the pandemic are extraordinary. So look at the gray bars to begin with. So already, just prior to the pandemic, the average woman who has children in her household in our survey reports that 70 hours per week are spent looking after one or more children living in their household without pay, whereas only 35 hours, the average man only reports spending 35 hours doing the same. So before the pandemic, we see stark gender disparities. But during the pandemic, look at the maroon bars and look at the jump. So what's interesting is that in percentage terms, those jumps are nearly the same. So it's a 40% rise in the average number of hours for women, and a 37% rise in the average number of hours for men. But when you look at the absolute number, women on average are going up to almost 100 hours per week, where men are less than half that. So the gender implications of COVID-19 in Canada are particularly striking. And I should say that, as I mentioned, we run this study in other countries around the world. So we've been asking these kinds of questions, for example, in Australia, and we see the exact same pattern. So this is not a Canadian pattern per se. This is a systematic pattern that we find can be replicated in other countries around the world. So we've looked at some of the groups that are particularly affected by the pandemic. Let's look at general attitudes towards economic reopening. As we know, the questions of whether or not to reopen the economy are quite salient in the current discourse, and how we reopen the economy, and what we reopen about the economy. So let's look at sector-based support for the lifting of all restrictions. So what this basically is, and unfortunately, well, that's unfortunate. Something seems to, okay, that legend there for some reason doesn't seem to be working properly in the presentation view. But hopefully it will work for the rest of the slides in that view. Okay, so what I have here is a time series, you'll see, of a number of different supports for, or a number of different sectors, and support for reopening those sectors. And so what you'll see is there's a cluster of 3 sectors at the top of the graph. So these 3 sectors, and we didn't ask this question in every survey. So again, you see a dotted line in periods where we didn't ask the question, and then a solid line in periods where we did. So we have 4 different data points for these lifting of restrictive measures in different sectors. And so we see almost across the board an increase in support for lifting restrictions. But we see a band of 3 sectors that have the most support for lifting restrictions. This support has been consistent, but it's even higher now than it was 7 weeks ago. So elective or non-urgent medical services, parks, and construction sites. Canadians are most in favor of lifting restrictions on those three, I'll call them sectors. Then we have quite a substantial band, it could be considered two bands below that, where we see, and I'm naming these sectors in order of of uh, um, the percentage of people who want to see them opened or restrictions lifted. So next we have hair salons and barbershops. Everybody wants a haircut. We have public libraries, which is pretty much the same level of support. Everyone wants access to their public libraries. We have retail stores. Now, interestingly, retail stores have sort of spiked around wave 12 and then dropped off a little bit, but still they have around the same level of support as the other two sectors that I mentioned. Also in that group, playgrounds. There's a lot of support for reopening playgrounds. Then in what I would say is still part of that middle band, but a little further down, there's support for reopening schools and lifting restrictions on schools. Less than half of Canadians support that measure at 42%. Child care centers, around the same number of people support lifting all restrictions on child care centers. And then we have colleges and universities, again, around the same level of support. So the education sector and childcare, these three cluster in around the same area. People have the same views to reopening these spaces. And then finally, restaurants and cafes sort of falls at the tail end of that band. Now, which sectors do we see the least support for? Well, we see the least support for movie theaters. Only about 1 in 5 Canadians says they want movie theaters to reopen. We see nursing homes, less than 20%, fewer than 20% of Canadians want to see restrictions lifted on nursing homes at this point in time. Although you can see that there's been an increase in support for lifting those restrictions, but it's modest. Bars and nightclubs, still on the no-go list for most Canadians. And finally, stadiums. So very few people want to see stadiums reopened at this point in time, or restrictions on stadiums relifted. So we can see here the kinds of economic activities that Canadians are comfortable removing restrictions around, and the ones that they aren't. Now, it's one thing to say that you're comfortable lifting restrictions, and it's another thing to say that you yourself would be willing to partake in some of these activities or go to these places. So we didn't want to only ask Canadians, are you comfortable with restrictions being lifted? We wanted to ask how comfortable they would be doing some of the following things. So we asked them a series of activities, and we also asked them how comfortable they were doing it before the pandemic, so that we could weight it according to that baseline to make sure that we're not distorting things. And these were the results. So there are 4 bars, 4 colors for each bar, and the legend is at the bottom of the slide. So you can see the maroon bars mean that people are not at all comfortable doing this activity, or wouldn't be doing it if restrictions were lifted tomorrow. The gray bar is not very comfortable. The teal bar means they're somewhat comfortable, and the green is very comfortable. So I've ordered these in terms of levels of discomfort. So most Canadians, a majority of Canadians, are not comfortable attending a concert or a sporting event, not at all comfortable attending either of those things. So we will continue to track this, but I imagine it will be some time before you see those levels of comfort return. Traveling by airplane, still a majority of Canadians say not at all. They wouldn't do it if they could tomorrow. Things like going to the gym, also almost half of Canadians say they're not at all comfortable with that. Using public transit's around the same. Sending kids to school. So here we start to see a bit of a decline, a bit more acceptance. There are, for all of us who are parents, I'm sure we are split on this. On the one hand, we can't wait. On the other hand, we have reservations. And I think that's what we see in the data as well. Interestingly, people with children are, and perhaps intuitively, people with children are less willing to send their children, less willing to indicate that they're comfortable sending kids back to school than people without children. Dining out in a restaurant or bar, this is starting to gain some acceptance. People are starting to indicate that they're comfortable doing it. But if you look at the maroon and the gray bar, it doesn't look like that's still more than half of Canadians, significantly more than half of Canadians, are still not comfortable or not very comfortable dining out. So this has implications for the restaurant sector going forward, as as we've seen for the entertainment and travel sectors. And then finally, working outside the home, people are starting to be asked to go back to work, and you see the highest levels of comfort with this. Half of Canadians, more than half of Canadians, say that they are somewhat or very comfortable with the idea of returning to the workplace. So that gives you a sense of where Canadians are in terms of their thinking about what they would be willing to do. How has the government fared in all of this? I mean, government approval is an important measure. In order to try and promote compliance with public health guidance, you need legitimacy. In order to have legitimacy, you need approval. So it's important to look at how people are viewing the federal government's interventions and attitudes, or interventions and policies and practices over the course of the pandemic. So when we look at government approval, we see that for the federal government, I should say we ask the question in two ways. The solid line is perceptions of the performance of the Canadian government in terms of protecting Canadians from the health risk posed by COVID-19. So do people think the government is doing a good job in terms of protecting Canadians' health? So that's the solid line. The dotted line is the measure of the government's performance in terms of mitigating economic risk, in terms of taking care of the economy during the COVID-19 pandemic. And so interestingly, we see that although at the beginning of the pandemic, these two things were indecipherable, throughout the course of the campaign, throughout the course of the pandemic, we've seen relatively stable views on mitigating against the health risk. In fact, if anything, the performance of the federal government has gone up since we started measuring in the middle of March. On the economic side, it stayed relatively consistent. So approval of the federal government's actions on economic policy are currently roughly where they were when we started measuring. So they had a bit of a bump in the middle of our measurement cycle, and now we see them roughly back where they started. So in terms of government approval ratings, these aren't terrible approval ratings. 72%, 73% is relatively strong. What we do see is that, and this is perhaps obvious, but we do see that this is driven a lot. Government approval, as always, is driven to some extent by partisan inclinations. So, of course, we see that the types of people who will strongly agree that the government is doing a good job are people who would vote Liberal, given the fact that it's currently a Liberal government. And you see that people who would vote Conservative or Bloc Québécois in particular are least inclined to suggest that the government is doing well. Let's take a look, because we're in Ontario, I thought we'd take a look at the Ontario numbers briefly. So if we look at the same questions, how well is the provincial government in Ontario doing on health mitigation measures and on economic mitigation measures? Again, health is the solid line, economic is the dotted line. Again, we see the same pattern. So the Ontario government is seen as performing more strongly on health mitigation measures than on economic ones. If we compare the federal and provincial government, we see, so again, these solid lines are health, and the red is the federal government, the blue is the provincial government. We see over the course of the campaign, there was a bump for the Ontario government in April and into May, and then it started to slide again. Whereas the federal government has, again, had a bit of an incline or an increase in terms of its approval ratings. So this is on health. Let's compare them on the economy. So again, on the economy, we see the federal government getting slightly higher approval ratings, or maybe substantially higher approval ratings, you might say, depending on your view. They're certainly statistically significant in terms of the federal government's action on the economy versus the provincial governments on the economy. So the federal government doing a little bit better at 62% versus the provincial government with only a 55% approval rating on its economic stewardship. So we've taken a look at how the parties perform, at how the governments have performed in Canada and in Ontario. Let's take a look at the leaders briefly. If we look at Trudeau versus Ford, interestingly, we see the inverse pattern. So actually, and we started measuring this in wave 4, which would have been in early April. And so if we look at Ford's leadership approval ratings, he has fallen. He was in the mid 70s, mid 75%, 75% roughly in early April, and as of last week, his personal approval ratings are at just over 60%. Trudeau has had a much flatter curve. His personal approval ratings have been quite consistent over the course of the campaign. A little bit of a decline, you might say, at the end there, and based on those confidence intervals, it does look like it might be statistically significant, but it's not substantial. And so it's an interesting pattern that the federal government is seen as performing better than the Ontario provincial government, but Ford's personal leadership approval ratings are beating those of Justin Trudeau. Now, we're coming around to the end of my presentation, but there are two more concepts I wanted to look at very briefly. One being trust and who Canadians have placed their trust in over the course of the COVID-19 pandemic. So first, we look at trust in the federal government, and what you see is that we've seen a decline in trust in the federal government, roughly 10 points, maybe a little bit less than 10 points, but a gradual decline, which doesn't appear particularly substantial. We see that trust in public health officials has also declined over the course of the campaign, but despite complete reversal on certain issues like masks, public health officials still command the highest level of trust of any institution that we measured in the COVID-19 monitor. So they still have the highest levels of trust among Canadians. Interestingly, when we look at the World Health Organization, we see something of a different pattern. So at the outset of the pandemic, we see the World Health Organization commanding a level of trust among Canadians that's not that far off from public health officials, and it's above the federal government. But of course, the World Health Organization has taken quite has been scrutinized quite heavily over the course of the pandemic, and now we find them actually falling, just dipping below the federal government in terms of trust levels. They've fallen quite a bit. In fact, of any institution that we've measured, we've seen the most it's been the highest decline that we've seen in terms of public trust. So that's an interesting finding, and a question as to whether the World Health Organization will be able to recover from that in the minds and eyes of Canadians. Now we added some other, partway through, we added some additional trust measurements. We asked about the news media. Given everything that was going on with misinformation and disinformation campaigns, we thought it would be interesting to look at trust in the media. And despite some, subtle variation across the last several waves of the COVID-19 monitor, what we find is that the media are less trusted than the federal government, and certainly much less trusted than public health officials. Now, fortunately, and we can all breathe a sigh of relief, when we ask about social media, those levels are significantly lower. And so we see the green line shows trust in social media, which only about 1 in 5 Canadians say that they moderately or strongly trust social media. So I spoke a bit about misinformation and disinformation. I'm going to end there because I think it's an interesting thing to look at and a logical extension of the trust analysis. And so when we look at misinformation, we asked people about some of the most salient conspiracy theory claims that we've seen in the public discourse throughout the course of the pandemic. So you can see on the bottom, I have listed each of the conspiracy theory claims that we gave to people in the survey, and we asked them how much truth they ascribed to those claims. And so there's quite a bit of variance in terms of what people put or what people believe there's some truth to. But what's interesting is that even though a majority of Canadians say there's no truth at all to all of the other conspiracy theory claims, the one where there is doubt and the one where it falls below the 50% mark is the notion that the coronavirus escaped from a lab in Wuhan. So this is, of course, has been a popular conspiracy theory. It's been one that's also repeated by the President of the United States. So there is an inclination among not an insubstantial number of Canadians to believe that this actually may have some truth to it. Now, again, if we look at the partisan divide on that, it's interesting to look at how the kinds of people that are likely to believe that claim. And again, we see that ideology, here I represent it through the proxy of partisanship, but we see that ideology does have a role to play. You can see that it is among more right-leaning folks that we get higher levels of credibility or ascribed to the idea that the coronavirus did indeed escape from a lab in Wuhan. So there is definitely an ideological effect to propensities to believe some of these conspiracy theory claims. And of course, given the deficit that we see in trust in the news media, there's some question around the degree to which news reports and investigative journalism could pacify some of the lingering doubts people have about the refutation of this claim. So that's a very high level look at some of the data from the COVID-19 monitor. I'm sorry, I've moved through it quickly. I wanted to be able to touch on a wide range of themes and topics and give you some just very sort of top line findings, but I'm happy to turn it back over to Jerry.
Well, thank you, Cliff. That was very interesting and very helpful for understanding some of the attitudes of Canadians surrounding COVID. I'm just going to ask one or maybe two questions and then turn it over to the audience and participants. I remind you that if you have a question, please put it in the question and answer function, and there it will pop up and I'll be able to see it. Cliff, I wanted to just start with one question that is a little puzzling to me. If I understood across some of your different sources of data questions, and that is when you started out very early in the talk, you showed that Canadians were actually growing less concerned about the economy, less concerned about being able to pay bills, and yet over time we see them having less or thinking the performance of the government in managing the economy decreasing. We of course have heard economists generally their assessments growing gloomier in terms of their recession being more serious and longer than was anticipated or hoped for anyway in the early stages of the pandemic. So I'm just curious if do your data give any insight as to kind of how we might reconcile these apparently differing trends, or what's really in the minds of the Canadians as they think about the economy and its performance?
Certainly. So I'm going to caveat what I say now with a note on interpretation. So I'm going to put forward some interpretations of the data that I would need to, of course, test with more scrutiny in order to validate them. But just looking at the data to date across the 15 waves we've conducted in Canada, it does seem like a lot of people or Canadians in general have been at first there's this doom and gloom of the pandemic and the economic shutdown, and then you have these multi-billion-dollar aid packages like the CERB and like the Canadian Employment Wage Subsidy that are providing this sort of artificial stopgap on the you know, collapse of the Canadian or global economy. And so when I look at the data, my interpretation is that Canadians had a sense that you know, there was going to be a complete economic meltdown, and then there wasn't. And so that sort of pacified them for some period of time. At least it wasn't that they saw in their own, of course, many Canadians have lost their jobs. Many Canadians are not currently working. But uh, it, most Canadians are still in their homes. Most Canadians are still able to get groceries. Not all, certainly, but most. And so to some extent, I think that may have had a pacifying effect. But as things drag on and as they hear more about you know, the inevitable economic fallout, and also as some of these stopgap measures come to an end, you're starting to see the reckoning that was almost put off or postponed for some time.
Okay. Thank you. I'm going to turn to a question from our participant, and it's focused on the mental health data that you presented. And the participant is asking whether or not you have any evidence of a correlation between the Canadians' media consumption habits and their reported mental health. So for instance, is the poor mental health amongst young Canadians perhaps due to some of their media consumption? And yeah.
So I would say we have actually looked at this. We've taken a cursory look at this, and the findings, and we do ask about media consumption in the tool. So, and the types of media, whether it's largely social media, broadcast, or other. And we do find a correlation certainly between, of course, age and social media consumption. And we also find a correlation between age and self-reported mental health. Whether the use of social media is the contributing factor, we haven't tested that directly in our data from this study, but we have done other studies where we looked at this specifically and did find an effect.
Mm-hmm. Interesting. Could I ask a direct follow-up on the mental health issue, since the most recent question was on that? But if I understood, again, your data correctly, what you're showing or what you see is a decline in the mental health status. In other words, more people reporting fair or poor mental health in the general population. And then when you look by age, what I understood, that was a snapshot at a point in time, which showed that younger Canadians had poorer mental health than older Canadians. But I'm just curious, have you looked at the change over time? So for instance, have for young people, has it gotten worse at a higher rate than older Canadians, or is that a pattern that exists in general, even outside the pandemic?
So you make a very good point in that, and I should have perhaps articulated that more clearly, but when I showed you the mental health figures, you're right that was across the entire 15 waves. When I look at it, when we break it down into a time series, we find that self-reported mental health status is actually relatively stable among all three generational groups. So young people were hit hard almost at the outset of the pandemic and of the lockdown. We saw the biggest jumps in the first few weeks, and they've stayed consistently low. I'd say there's a gradual decline for young people. The other two generational groups are pretty stable across time.
Okay. I have a question about some of your data on conspiracy theories. And again, if understood it correctly, you presented the results of asking that question at one particular point in time in terms of the support for some of those conspiracy theories. And the question asks, when did you ask that question? So what time period do those data reflect?
Yeah, so we actually have asked it several times. You're right that I took a snapshot. I took the overall numbers. I just didn't want there to be too many time series, and I thought the overall numbers gave us statistically significant results because they shrink the confidence intervals. But we've asked that question quite a number of times. I would say probably about I'd say now 4 or 5 times over the last 15 waves. And I can certainly run the time series if you'd like to send me a tweet or an email. I'm happy to run the time series to whoever's asking and give you a sense. But I will say that the rough finding of the time series is that people are becoming more, and especially on the Wuhan lab conspiracy theory, people are becoming more and more willing to suggest that there's some truth to that particular conspiracy theory.
Mm-hmm. Okay. I think another set of striking results that you showed related to masks and mask attitudes towards masks. And I have a question here, and it relates to something I think that's been confusing to a lot of Canadians probably, and that is, of course, early in the pandemic, the advice was don't wear masks, and it was actually explained as they're not effective. And then later, of course, as you noted, there was a reversal in which they said, well, they can be helpful. And in fact, the initial advice was given because we didn't want people to go out and purchase all these masks that were needed for healthcare workers and other first responders or people working on the line, so to speak. I mean, I guess the question actually is about, what are your thoughts about this explanation and the changing explanation provided by, and then also, what do you think has been the implication of that for Canadians at times seeming confusion and not really knowing how to think about masks in the context of the pandemic?
Yeah, no, it's an excellent question. So, yeah, the initial justification for that public health officials and the federal government provided for actively discouraging the use of masks was threefold. And the first sort of point is probably the entire reasoning or rationale, and that is that there was a fear that there would be a run on personal protective equipment, and particularly masks, and that would leave our frontline healthcare workers without the PPE that they would need to keep safe on the job. And that alone is a perfectly reasonable and rational explanation. The discourse became muddied or mixed with additional sort of justifications for discouraging mask usage. Those included scientific evidence suggesting that people who wear masks are less likely to adhere to social distancing or other preventative measures, or are more likely, let's say, to touch their eyes or fiddle with their mask and possibly increase the rate of contraction or the probability of contracting the COVID-19. So all of these, these were sort of all of these different reasons were given when really at least two of those rationale have been now sort of almost disqualified or at least discounted by follow-up studies. So we have colleagues, researchers at McMaster in health sciences who have published in the Lancet saying, actually, the scientific evidence to suggest that masks don't do anything to reduce the risk of transmission is not substantiated by the epidemiological evidence that we currently have at hand. And in terms of people engaging in fewer preventative measures, some of my students and I have just put out a piece in Canadian Public Policy, the journal, that shows that the Canadians who do wear masks are actually more likely to adhere and comply with other preventive measures. Now, we can have a discussion about why that is, and there's a certain type of person who will wear a mask, and that type of person is probably more risk averse to begin with. But nevertheless, the only explanation left that I think that the government and public health officials can stand behind is the argument about the run on masks, and that could have been the sole justification in my view. But I can understand being in the place of those public health officials and government officials and looking at what had just happened with a run on toilet paper and saying, I'm not sure that telling people not to buy masks because you're going to take those masks out of the hands of frontline healthcare workers is going to be enough. So I think it's, I can understand why they did what they did. What are the implications? interestingly, the implications have not been, as far as we can tell, a loss of trust, a significant loss of trust in public health officials or the federal government. Now, both of those groups were scrutinized, criticized, lambasted, you might say, by pundits in the media, and certainly within elite discourse over the policy reversal on masks, but it did not really gain traction in the Canadian public. There's still a lot of faith in public health officials. If anything, if there's anything that we can say about what the impact was, it is probably that the earliest guidance on masks artificially depressed the use of masks by Canadians. My sort of counterfactual is that more Canadians would have been wearing masks earlier as a simple preventive measure had they not been actively discouraged. So there's a reckoning to be had there. Whether or not it's worth it because you saved PPE for frontline healthcare workers, that's another story. One could also argue the other way on the counterfactual. Would more people be wearing masks now if the line on masks had been consistent from the beginning? And that we can't answer.
Mhm. Okay, thank you. Again, I'm going to remind people to put your questions in the question and answer function in Zoom. And I have a question here that it follows up on some of the your response about tracking media consumption. And the question really pertains to the issue of, I mean, Canadians consume media from many different sources. At times you were saying it seemed like the behavior didn't really track necessarily with some Canadian specific guidelines or restrictions and so forth. And I'm just curious in this question around, does it track with some other broader trends we see internationally? Or does it seem like Canadians are responding in part to what's happening internationally or in some other prominent countries, rather necessarily than what might be happening in their own country?
Yeah, it's a very good question. So I can bring it, actually just, I'll tie it in with the masks question, because one of the interesting findings there is that the spike in mask usage among Canadians started on April 3rd when the US Surgeon General put out guidance for making cloth masks. And it predated Theresa Tam's change recommendation, which indicates that actually that the U.S. Surgeon General's revised advice had as much an impact on Canadians' initial sort of decision to take up masks as did Theresa Tam's. In terms of conspiracy theories, when we look at who's more likely to believe conspiracy theories, and we also ask people what media they consume, and actually asking them for outlets, and we certainly find that among Canadians who consume particularly right-leaning U.S. News media, the propensity to believe in conspiracy theories is substantially higher than among the general population. So there is certainly an influence, particularly by U.S. media, in terms of how Canadians are reacting to the pandemic.
Mm-hmm. I mean, would that suggest that obviously the most recent wave you have was last week, and so it predates some of the most recent very serious concerns about the spikes in the US. Does that mean you might anticipate it could have an effect, the US experience might have an effect on Canadians' attitudes towards our own reopening and the pace at which we do that?
Only time will tell and the data will tell, but my suspicion will be that we'll see a decline in support for lifting restrictions in certain sectors.
Interesting. I want to pick up on this theme of some differences by there are a number of aspects you looked at differing by political affiliation or of the respondents. It was a little surprising to me. I mean, Canada is, of course, much less rights-oriented in the rhetoric and the language compared to the U.S., and yet we are still seeing some stark differences in some cases between those who lean conservative and everybody else, in a sense, where we don't see much difference. Do your data have any show any insight about that? Maybe it relates back to your most recent point about media consumption, and it might be differences there. But more generally, I'm curious, are there any other kind of cuts where you see some stark differences by whether it's gender or age or some other, kind of prominent characteristics of individuals?
Yes, so I mean, there are sort of two questions there. One is about ideology, and one is about what other segments do we see interesting trends around. Um, uh, in terms of the um, sort of conservatives versus the rest, I guess you could say, findings in the data, what the data allude to. I mean, one of the things we have to think about is how much of that is conservative ideology in Canada and how much is it is sort of anti-incumbent, you know, hostility, if you will, towards the current sitting government. If the current sitting government was a conservative government, would we still see Canadian conservatives flouting some of the guidance that we've received in the numbers that we've seen them flouted in, as per the data? So there, as with anything, it's a multivariate explanation, but there is certainly consistent evidence to suggest, particularly that one time series I showed you, where you see the clear ideological divide, and it's significant among the three groups, that I have another paper in the Canadian Journal of Political Science with Mark Pickup and Dominic Stekula, where we compare Canada and the U.S. in terms of ideological responses to COVID-19. And what's interesting is at that time, what we saw among Canadians was the rhetoric that Canadians would use and the sort of their views of the government response would be tainted by their ideological or partisan inclinations. So if they're a conservative supporter, they would indicate that the Liberal government's reaction was was poor, but they were still taking on what they were still adhering to that guidance, adhering to that advice. Now it's been several more weeks, several more months since we published that paper, and now we're starting to see patterns that look a lot more like the American ones, where people are starting to engage in behaviors on the basis of their sort of ideological self-identification, and that it starts to stand for something. So it's difficult to determine which one is doing more work here in Canada, and that's certainly a place for further research.
Mm-hmm. Interesting. I'm curious, specifically, you of course focused on gender differences in home work, home responsibilities, both in general and child with respect to child care. And does that, so that has to have an impact, obviously, on the lives of women compared to men. And so do we see differences in other aspects of both the behaviors and the attitudes about COVID by gender?
Absolutely. And there's so much more to be done there in terms of the research. But what we see so far in the data are that women express higher levels of concern than men about most of the areas where we're tracking concern, particularly about other people's the possibility of family members or friends contracting COVID-19. So women are a lot more worried about that than men, or think about it a lot more often. When we look at the mental health of women, especially women who have children at home, and perhaps for the reasons we articulated, but one can't jump to conclusions. I think it's pretty strong hypothesis, though. We've have a whole battery of mental health tracking measures, self-reported levels of anxiety, of stress, of fear, and on all of those measures, women in general report higher levels of anxiety, of stress than men, but particularly, again, women with children under 15 years old in the household. Those levels are far and above the general population. They are far and above other women who do not have children at home, and they are far and above men who also have children at home. So we talked about the effect, the generational effect, but the gendered effect on the mental health of women during the COVID-19 pandemic is also something that we need to recognize.
And I wonder, we talk, there's a lot of prognostication about, what effects or what current phenomena we see are going to be permanent changes, what are just transitory changes. I suspect your data can answer this, but certainly one question we want to understand better is, are some of these shifts in responsibilities going to be something that's longer lasting even after the pandemic, which has, would have quite dramatic implications for how the burdens are shared between men and women in society.
I mean, I'm speculating now, but I mean, we saw the data at hand, which didn't only discuss the additional workload that women were undertaking in their households during the pandemic, but also certainly they were doing more work in the household on average before the pandemic. So you imagine the gender disparity that already was in place, and then the pandemic amplifying that disparity, and then try to think about how do women in general recover from that in the post-pandemic period, so that they're already set back so far. In terms of, we've seen this even in academia. We've seen studies that show that the number of publications in many scholarly journals where women are the first authors has dropped substantially during the pandemic. And again, it speaks to prevailing and pervasive structural expectations about gender responsibilities and roles in the household, and that continues to disadvantage women in terms of their career and workplace progress.
And I guess, I mean, this makes me think about, I mean, one of the things the pandemic has shown, I think, is, in the presence of a virus like this, coronavirus, for which we have no vaccine, we have certain treatments when it becomes acute, but there's almost all of the burden of response has fallen on social and economic and non-health, other than, of course, treating those who have acquired the COVID. And it's revealed areas where we probably have underinvested, certainly in aspects of public health, but even more broadly in some of our community and social infrastructure that has been put under tremendous stress and has failed, frankly, certain segments of our society. And I'm curious, when you ask about government response and investment, is there any insight? I mean, there is, it's quite fair and understandable to invest in construction in some of those in similar industries, but do you see any evidence of a similar call for saying we should be reinvesting in some of these social kinds of infrastructure that is also, frankly, where a lot of people have lost their jobs, is those not, who work in offices or who work in various settings like that, for whom such investment might have a big impact, and it would address some of the social community aspects of that have been revealed by COVID.
So I mean, I think that's a very poignant observation. It's somewhat outside of the scope of questions that we've asked, but we have asked questions about things like a universal basic income, and we've seen support for universal basic income increase over the course of the pandemic. So I think for a segment of the population, it's a recognition of the deteriorating guarantees of the social welfare state that the pandemic has laid bare for us to see, and to that end, the few proxies that we have for that sort of social infrastructure investment would tend to suggest that there's a recognition of its deficits and support for a redress of those deficits.
Interesting. Well, I mean, I think it's going to have to be an important part of the conversation going forward as we think about kind of trying to reinvest in our physical and our social health infrastructure. I'd like to come back to a point. Again, it speaks to kind of two parts of your presentation: the part on compliance, and then the part on trust, and in some sense also assessments of the performance. And as you're aware, many commentators, when they look around the world at countries that have successfully, flattened the curve or squashed the curve, so to speak, versus those that have really struggled to gain control of the pandemic, point to trust, social trust in institutions and society. you show it at an aggregate level, Canadians are relatively compliant with most aspects of the public health guidance, um, and indicators of trust are are reasonable, and belief in performance of government's reasonably strong, and so forth. Does that play out the individual level as well, where those who indicate the highest kind of trust and highest assessments of the performance are the ones who are complying more? Do we see that playing out in your data?
So the short answer is yes, there's certainly a social capital argument to be made in the Canadian context. High trust in public health officials is, when we include it as a regressor in a model, we see that that's a statistically significant indicator of propensity to engage in preventive measures as advised by public health officials. So yes, there's a a clear link between trust and compliance in our data. And I think even if we look beyond our data and we look at what's going on in the United States right now, and the levels of trust we see for and the erosion of social capital in the United States, and the implication for compliance with health measures, it seems to support that thesis.
Interesting. Are I mean, there's two worries you hear in the media, or there's more than two, but a couple of ways. One is that people are getting tired. People are getting, worn down in a sense by many aspects of this and how their lives have been changed, and a concern that's going to lead to a slip in compliance. And then you also hear, of course, the concerns about the second wave coming in the fall. And I'm just curious again, if your data ask at all, or any way ask people about looking forward in kind of how they anticipate the next period, and how they're thinking about that?
Yes, so we ask about outlook. So we ask people about what their outlook is for Canada, for the world, for future generations. And it's been it's actually been a sort of a mixed bag. In some cases, we see a more positive long-term outlook, and what we've been able to distill, or what we've been able to derive from those findings, are that people are reading some of those questions as looking forward to when this is over. I'm so excited for when this is over. I'm excited to go back to my normal life. So there's a yearning to have this return to normalcy. And in some ways that's part of outlook, and that's but what the world will look like at that time, there's a lot of pessimism about what the future will look like, and what the opportunities will be once this is all over, and the lasting damage of this pandemic. Which, to your point earlier, is going to require a lot more than investments in health. It's going to be about rebuilding society and rebuilding social infrastructure in order to try and cope with the lasting sort of implications of what's happened here.
So they're kind of hopeful, but also scared in a way.
Yes, hopeful to get back to...
They don't know what it's going to look like.
Yeah, so we ask even open text questions. We ask people to tell us, what you're most excited about, or what you're most looking forward to when things return back to normal. And the number of people who write hugs, the people talk about the simple joys that they miss in their everyday lives, and that have really it seems like there's a renewed sense of appreciation for those simple joys, which are suddenly absent when we never expected that they would or could be. So I mean, it's really, for many people, it's about hugs.
Yeah, very, very simple everyday things that we took for granted for all of our lives, I guess. I'm gonna switch gears a little bit, in that you focused on Canada, and understandably you focus on Canada, and obviously this is kind of a big question I'm asking you, but it was tantalizing to have you make some references to Australia, and I believe it's the UK where you're doing this, and I'm just curious if in a few minutes you might highlight what you would see as some of the most interesting or important differences in the way Canadians have thought about this and responded to it, compared to, I guess in those two cases, anyways, our Commonwealth neighbors. Um, what stands out for you when you think about the Canadians compared to some of the folks in other countries?
As a general observation, I would say that it's interesting. It's more interesting how similar reactions have been than how different they are. What stands out to me is how global this pandemic has been and how it's affected people at a personal level in ways that are quite similar and comparable. It's a unique, almost unifying moment in terms of people's experiences. So that's been, I would say, the most substantial observation. In terms of smaller observations, I would say that um, uh, Canadians are, from our data at least, Canadians seem to be more supportive of longer lasting sort of restrictions and preventive measures. Canadians seem to be more risk averse, if I may, than both people in the UK and Australia. There are some interesting differences, like we go back to masks only because I've done a fair bit of research in this space recently. There has been absolutely no increase in self-reported mask usage in Australia at all. It's been level at the and it's been level at the levels of the lowest uptake that Canada had at any point. So people are not wearing masks in Australia. They have no desire to wear masks. They have no desire for masks to be mandatory, and yet, you know, um, and in terms of their progress in flattening the curve has been much better than ours, for a variety of reasons. Certainly not because of masks as the only variable. They closed borders sooner. They imposed certain restrictive measures earlier. And they're isolated as an island. They're not bordering the US. So, I mean, there are all kinds of explanations that contribute to their performance vis-a-vis ours. But that's one where I noticed a sharp difference.
Um, I'm conscious we're closing in on 25 after here, 25 after the hour. I'll just throw you another kind of open-ended question about you've been looking at these data for now 15 weeks at least. Obviously, you've shared with us some of what you felt was most interesting, but if you had to say what stands out most for you as you've watched both attitudes and behaviors change, that you feel that the monitor has been really important to tease out about Canadians' responses to the pandemic, both attitudinal, behavioral, and otherwise.
So in terms of policy prescriptions, I would say that one of the things that's interesting to me about Canadians is that they seem to be, there seems to be an absence of a sense of, let me back up and try to rephrase this. Canadians seem to be willing to take some very difficult restrictive measures up front for a shorter period of time than to sort of let things linger and have sort of half measures in place. If I can say anything that I've learned from looking at the data over the last 15 weeks, it's that most Canadians are supportive of the measures that they feel are necessary to eradicate or completely contain the virus. Where they get impatient and somewhat where they get impatient is around the half measures and the notion that that they are that the collective measures that are in place at any given moment are only going to go so far, and we're going to continue to have to battle with new cases and new transmissions. So I think if we could go back in time, and hindsight is always 2020, I think Canadians would have been much more supportive of even stricter measures for a shorter period of time at the outset of the pandemic if the result of that was near eradication of the virus. And when we, look at things retrospectively, I think that's where Canadians would say they would have landed. And the what you're seeing now, and you've pointed to it yourself, Jerry, what you see now is a gradual sort of fatigue with what are perceived as being, in some cases, half measures, even though they're very strict and very severe, like, but nevertheless, that fatigue is setting in, and now people are, to some extent, just checking out in terms of compliance. That's why the talk is called From Crisis to Complacency. I think you noted something, Jerry, in your initial observations of the data, which is that you don't see a lot of sharp spikes in the time series that are perfectly lined up with new regulatory actions. So what you see are gradual changes. And so I think actually new policies or new advice is lagging, not leading societal changes in Canada. I think Canadians are acting collectively, and that fatigue is manifesting to a certain extent, and the government is sort of adapting, or governments are adapting policies to reflect where Canadians are, instead of perhaps leading Canadians to where they need to be.
Mm-hmm. Okay, thank you. I have to actually take a minute to apologize. The question and answer window works differently than the chat window, and it doesn't scroll automatically as questions come in. And so what I had not realized is that there are some questions accumulating below my window that I did not realize were there. And so in fact, there have been some questions coming in that I've been unaware of. And I apologize to those who posed them. Thank you for the person who asked the question in the chat about why I'm not paying attention to the questions in the Q&A window. And again, I apologize. We are really now at 27:28 after. I guess I'm gonna say, if I were to say where there's more of them, there are 2 or 3 questions focused around this issue of mental health and and the impact of COVID. And a couple of themes are, is it related in any way to economic security, particularly for young Canadians who have suffered higher rates of mental health? There's an interest in alcohol and drug consumption and so on and so forth during COVID, whether or not you have any data on that. So kind of a small cluster of questions around wanting to really understand better, if possible, some of these mental health issues and some of the correlates of the mental health concerns.
So I'll just say that we do have questions both in Canada and Australia on alcohol and drug consumption during the pandemic, which has increased in both countries and among particular groups as well. I also now see the Q&A window, and so the person who asked that question, it's someone who I'm happy to get in touch with any day of the week to share that data with.
Okay. If you don't mind, I may take 1 or 2, because I feel very bad for having missed this. There is, of course, intense interest in the U.S. border. And do you ask any questions about people's attitudes towards the reopening of the U.S. border?
Yes, we ask every week if people would be willing to, what the support would be for reopening the U.S. border, and it has been consistently, Canadians are consistently against the notion of opening the U.S. border at this time. If anything, that sentiment has increased in recent weeks, not decreased. So it's it's a pretty consistent finding in the time series.
Interesting. And this week is only going to make that more stronger, I believe, probably, when they watch what's been happening down the States. Another question about trust. And do you see gender breakdown in levels of trust in the institutions and in the leaders?
So I haven't done a lot of breakdowns by gender in the institutions, but in the leaders, we do see some gender variance, not always statistically significant. But I would say that among you have higher levels of support for right-leaning parties by men in Canada, and higher levels of support for left-leaning parties by women in Canada, and that would be my general. This is not a specific analysis on a specific wave, but a general observation that we see when we run vote intention across all the different waves.
Mm-hmm. Another question kind of related to the economic versus health questions, and you know, do you see, do you have any data that speaks to issues both about possibly reclosing or reversing, and generally how people are thinking about what has been portrayed as a trade-off or a tension between pursuing economic goals of growth in getting the economy kick-started versus the health concerns? Do you data for any insight about how Canadians are thinking about that?
I would say that, I mean, to some extent, we have created survey items that reflect that dichotomy because it is salient in public discourse, and we've created items that question that dichotomy. For the most part, if it's presented in those dichotomous terms, which I recognize is a matter for debate, but if it's presented to Canadians in those dichotomous terms, there is variance, but you will see more support for health measures or maintaining the health measures that are currently in place in order to prevent further transmission of the disease than I guess what people might refer to as premature economic recovery options, although, again, that dichotomy is very much up for debate and scrutiny. These vary significantly. Men are far more likely to say, open the economy and open it now, lift restrictions, and whereas women are much less likely. Younger people are more supportive of continued economic restrictions than older generations are. So there are clear divisions along sociodemographic lines here.
Okay. And I'm just going to look to two more questions. One is, you've pointed to this somewhat in that people, what they miss most is some of the very simple things in life, like hugs. But do your study tell you anything, or what might it tell you again about recommendations to improve quality of our lives post-pandemic? You talked about needing to rebuild society to a certain extent. Does it point to particular things that we need to focus on in that effort to improve the quality of people's lives?
So I would say that this is it's a reading or an interpretation. It's my own reading or interpretation of the data rather than asking the question directly. But certainly, I think, and this is not something that is new or unique to this study, but it is something that the study helps validate. There's been a lot of discussion around the notion that the pandemic has exposed existing systemic or structural disparities between social groups of all different types, and in many different facets of the survey, we see a growing frustration with those social disparities, a growing recognition of them, and a growing frustration with them. And so I think that says something for at least the shape of the arguments that the shape that arguments will take in a post-COVID public reckoning with what's happened.
In the last question, actually, I'm just going to pick up on your theme of things that that the pandemic has revealed. And of course, in Ontario, also Quebec, long-term care sector has been an area of particular focus where the pandemic has revealed some quite deplorable conditions. And the question is about, can we see in the data both on trust or belief in the performance of government and or leaders such as Ford? Do we see the revelations around long-term care having any impact on people's trust in understanding the performance of governments?
So we do ask, and we have been asking since the beginning of the COVID-19 monitor about long-term care. We ask a variety of questions on attitudes and prescriptions for long-term care in Ontario and Canada. One of the things that's interesting is we ask people if they have a friend or family member in a long-term care facility, and that has a statistically significant effect on their approval ratings of the provincial government. So that's an interesting finding. Now that effect isn't consistent. It's not always significant in every way, but it has been significant in a number of ways, which suggests that this is going to be an area where there will be some implications come voting day in Ontario.
Thank you. We are over, so I will want to wrap this up. I want to thank you, Cliff, for a really fascinating evening and discussion of your data and the insights that you've been able to tease out of the data. It's been really very, very interesting to learn. It's hard. We all, of course, are glued to the media in many ways to follow what's happening, but I think this kind of detailed level of data and analysis is something that, of course, most of us, we don't have access to every day in the media. And so it's been just really interesting, really fascinating. And I want to congratulate you guys on the project itself. I mean, I think it's tremendous that you're able to get out every week for a couple thousand Canadians and to be able to follow their attitudes and behaviors and the impacts that COVID has had on them. So congratulations on the study, and thank you very much for your remarks this evening. I want to close by acknowledging that, again, a key sponsor of this has been the Socrates Project. This is the last event of this season for the Socrates Project. There will be some more events starting up in September with a very large forum that they're going to be putting on. And again, this has been a tremendous initiative that McMaster has been able to put on through the generosity of a donor, Red Wilson. And so I want to thank the Socrates Project for its support for tonight's event. And with that, I will sign off, and thank you also to the participants. And again, my apologies for not knowing where your questions were until too late. But we got to at least some aspect of most of them, a little more hurriedly than I would have liked. But thank you for your questions and your participation this evening. Good night.
Thanks very much, Jerry. Thanks very much, everyone.